Tēnā koutou katoa. I'm not going to do a long introduction because we have a very short period of time. Cornick Jones Tokungo. I'm a Director of Public Health, working for the Public Health Agency, which is a newly created agency within the Ministry of Health in our current health reforms. And what I'm going to be talking about today is thinking about shivers and respiratory virus surveillance from the viewpoint of someone who's advising government on what's the appropriate response, both in terms of an immediate risk and also in the longer term. So I've only got one slide here. I'm just going to run through some thoughts around what we would see as being key objectives for shivers and respiratory disease surveillance going forward. And these will be obvious, I think, to many of you, but I just want to run through the list. So obviously the early detection of a respiratory disease epidemic, whether it's a seasonal one or a pandemic, early detection is critical. And once we have detected an epidemic, we need to be able to understand and predict what's the likely magnitude, what's the impact going to be on the health system, what's the impact going to be on primary care and on our staffing. We want to characterise the epidemic in terms of its characteristics such as its severity, its transmissibility, and also we're going to talk about this later today, but we need to understand zoonotic epidemics and their interactions with human health. So for example, if we were to be affected by avian influenza. Then I think moving on to some of the other aspects of the Shivers platform and what it can achieve is really understanding what's going on with the population in terms of our immunity and to any emergent threat. And I think also the interactions between different pathogens and how that impacts on immunity. The likely impact on vulnerable populations and the equity impacts, particularly in New Zealand, where we need to think always of the impacts, particularly for our Indigenous population and for our Pacific population, but also thinking about the impacts of respiratory illness, particularly on the elderly. And we know that with the elderly, there is a phenomena called increase in frailty that results as a result of insults such as due to influenza or other pathogenic illnesses, where they don't fully ever recover, and so there's a consequential decline in functionality. Then I think the use of rapid antigen tests or other point-of-care diagnostics, not only to guide response, but also I think potentially as we are now seeing in New Zealand for use in surveillance. The information on the effectiveness and availability of both vaccines and antivirals is critical. And then advice that can help us to provide advice to government as to where these tools should be targeted. So, for example, thinking about vaccination, and particularly now that we have immune evasiveness of SARS-CoV, the notion of herd immunity is no longer so valid, and so advice on how to target vaccines and antivirals to have the greatest impact and reduce the impact on both morbidity and mortality. I noticed, Sue, you mentioned neuraminidase targeted influenza vaccine, and I'm very interested to hear more about that. I think that's part of a general discussion around how we move to more stable vaccine and longer lasting impacts. And then one of the questions I do want to raise is, and I don't think we cracked it yet, but maybe Shivers can help us, is around understanding what is really causing influenza-like illness in general practice. And because of the similarity in the clinical syndromes, we've had a great deal of difficulty, I think, understanding and interpreting the dynamics of the different causes of influenza-like illness in the population. There were a couple of other things. Those, I think, are sort of the main objectives from a surveillance point of view. I think the other thing to think about, and it may not be something that Shivers is so useful, but I think government has an interest in auditing our responses to respiratory illness. So if we have, for example, decided that the most appropriate populations to receive antivirals are such and such a group, are they actually getting the antivirals? Because if we're seeing continued hospitalizations, is it because our system is not actually delivering to the people who we've identified should be getting those medicines. Similarly, what is the coverage of our vaccination? And again, have we got inequities in terms of the coverage? Some populations not receiving access to immunisation as well as they should. Climate, obviously, we've already heard from one of our speakers about the importance of climate. I think there are things probably, even with respiratory viruses that are spread from a person-to-person basis, around ventilation, humidity, that all may be relevant to understand as we move into the future. And then the interactions, I think, between SARS-CoV and influenza will be interesting and important to understand. What is the role of neutralisation assays in terms of assessing immune evasiveness in New Zealand versus looking at T-cell responses? But I think I'll leave it there.